Hello, my name is Jill Berry Bowen, CEO of Northwestern Medical Center, and your host of the NMC Health Beat Show, dedicated to discussing hot healthcare topics. So today on our show, I'm joined by Dr. Julian Ferris. He's the medical director of our Hospitalist program, and he's here to talk about the Hospitalist team at NMC. He most recently worked as a hospitalist and chief medical information officer at Mission Health in Asheville, North Carolina. He's also worked extensively in hospital quality improvement and in the IT world of healthcare. So, Dr. Ferris, thank you so much for joining me on this program.
Thanks for having me.
So I know there's going to be a lot of questions, so this is a perfect topic because when you think about the way healthcare has been, where your doctor in the community would follow you into the hospital if you were sick, so you got that one doc. So now there's this new concept of hospitalist. So can you describe what the hospitalist program is and how you make that connection with that community doc?
Yeah, so the Hospitalist program we're a group of medical providers who specialize in the care of the hospitalized patient. So if you come into the hospital and you need to be hospitalized for whatever reason, and you need medical care, frequently that's when we become involved. And it does vary. It does change that old paradigm that we grew up with Marcus Welby, who would see their patients at home and see their patients in the office and see their patients in the hospital. But as healthcare has become so complicated, and as healthcare delivery and how we care for patients has become more complicated, the time needed to take care of patients in the hospital has become more demanding.
Sure.
At the same time, Dr. Welby, who was taking care of patients in the community, is finding that he or she is needing to spend more and more time in the office to take care of their office patients. Sure. So the demands were becoming so great. And as a result, we had this sort of growing field of hospital medicine, and then the term hospitalist came up to really describe the specialist who cares for patients in the hospital.
Mm-hmm. So is it physicians that are on the team, or what's the team look like?
Yeah, so at NMC, our hospitalist team is made up of 11 providers, and we all two of our providers are nurse practitioners. They're excellent and very experienced nurse practitioners who provide care for our patients. The rest of the providers are specialized in internal medicine, and that makes up our full team. Nationwide, the hospitalist movement is made up of both internists, advanced practitioners like nurse practitioners and physician assistants. Family physicians have specialized in hospital medicine, and now we're seeing different fields develop specialties within hospital medicine, such as obstetrics and surgery and other fields where they have a dedicated provider caring for the patient in the hospital. In our case, we provide internal medicine or adult medicine care for the hospitalized patient.
No, that's awesome. So what can the patient expect with a hospitalist? From the patient's perspective, what would they anticipate with this inpatient care?
It's one of the big things that I think can be confusing and a little bit. It's disorienting to be in the hospital anyway, and it's difficult. It's a very stressful time, and you're meeting a lot of new faces, whether it be nurses or other staff such as respiratory therapy or the pharmacist, and the hospitalist is part of that healthcare team within the hospital. So what we really do is we take a team approach to providing care, and that includes the hospitalist, who may be a physician or a nurse practitioner, working with your nurse, your pharmacist, your physical therapist, and case manager to help take care of you during your stay in the hospital. And during that time, you'll be rounded on by the hospitalist, and they'll be helping to coordinate your care with that larger team. As part of that, we do rounds, so a lot of the work happens outside of the room, whether it's reviewing results, reviewing records, talking to family, talking to your healthcare provider, talking with the team in general, whether it be the nurses or pharmacists or physical therapists, all helping to coordinate your care to try and provide the best care that we can for you.
And what type of training do you need to be a hospitalist?
Not much, no. That's the part that gets edited out, right? Our team is made up of internal medicine physicians and nurse practitioners. So our training is through that specialty. And all of us have had additional years where we have been caring for patients in the hospital setting and have specialized and focused our care in that. There are developing nationwide specialty training tracks for hospital medicine, and we're seeing that more and more. The hospitalist field and hospitalists, as has been said in a lot of different areas, is one of the fastest growing medical specialties in the country. And so as a result, we not only have our own medical society, the Society of Hospital Medicine, which is part of the American Academy of Physicians, but we're also having a focus in hospital medicine through our medical boards. So I'm an internal medicine doctor who's boarded through the American Board of Internal Medicine, and we have a focus in hospital medicine. And then there are also training programs that are also specializing and providing additional training in that area.
So where do you think the hospitalist program, how is this going to evolve? We've gone from primary care doc and seeing patients in the home, in their office, and in the hospital. And so what do you think the future is of this type of care?
Well, it's becoming more, just like healthcare is becoming more comprehensive and has become more of a team approach. Hospital medicine is also going in that direction. Providing health care, providing care for a patient is more than just seeing you, examining you, and writing a prescription. It's really how we provide care. So hospital medicine is becoming integrated into all those initiatives in the hospital. We're integrated into the quality of care that we provide and the safety of how we provide health care and how we deliver health care. And as a result, we're becoming increasingly integrated into whether it be infection control in the hospital or controlling, integrated in the formulary of the hospital, integrated to our other departments. So we closely work with the emergency room department in terms of how we admit patients into the hospital. We're integrating with our primary care community for those transitions in care when patients leave the hospital and go back to their primary care physician. And we're working with the hospital to make the hospital a safer place to provide health care. So it's a much more broadened concept of how we provide health care as opposed to just sitting down and examining a patient.
Sure.
And that's just going to become more and more, particularly with all the initiatives that are going on both in Vermont and nationwide. As you know, we're working closely with the ACOs, we're working closely with our healthcare partners throughout the state, our community, and throughout the state.
So you mentioned ACO, and I know we work on a council together to try to improve care. So this coordination of care, we're doing it across the community and across the state. So is this really going to improve patient care? I mean, are we on the right path to improving patient care by that greater coordination?
Yeah, I think that we would all agree that greater coordination is vital to healthcare. Not only are the things that we're doing in the hospital mirroring and continuing in the outpatient setting, but those transitions when patients go from their home into the hospital back out into the community are all part of that continuum of care that we're all striving for. And we've seen nationwide that the greater coordination in care really helps to improve outcomes. It improves quality of how we provide health care and the outcomes that we're achieving, and also improves safety. and that's what everyone's starting to expect. We're expecting better coordination with our providers, both in the hospital and in the community. We're expecting the best health care that we can provide so that patients can achieve the outcomes that they're desiring, whether it's getting back on the slopes, getting back home and getting back to work, spending time with their families, going on vacation. That's all what we're striving for.
Yeah, exactly. It's nice to hear it from a physician that that coordination of care is working, and
it's vital, don't you think?
I do too.
Yeah,
I mean, but these administrative types, we want to make sure we're well connected.
That's right. That's right. And I got to say, and you've just taken a great lead in these accountable care organizations and how NMC is integrating within our community, but also within the state. So I really appreciate what you're doing, Jill.
Oh. Well, thank you. It's fun to partner on these things because we don't know exactly where we're going, but if we do it together, we can make sense of it. And
there you go.
We have a common purpose, which is about taking exceptional care of our community and our patients.
Right.
So it's all about the patient. So when patients are in the room and you come in, and the computers come in too. So how is information? I mean, you've got this background in information systems. So what does this mean for patient care? And so I know it's always going to be with us, but talk a little bit about the computer that's in the patient room with you.
Right, and I'm sure patients have never heard their doctor or provider complain about the computer. Never.
No, I love it.
It's been one of the biggest transformational things in healthcare over the past 10 years. And informatics, the computer, and those resources have played a larger role in healthcare.
Yeah.
The way I view it is that that informatics and information systems are just another tool that we use. It's just like the stethoscope I wear around my neck, the ultrasound probe that a technician would use. And where the computer really helps us to a large extent is helping us not only with those communication venues, helping to communicate throughout the care continuum. That's the hospital, the rehab center, the pharmacy, the doctor's office, but now even in your room, in your own home, and in your own computer, and even in the hospital room where patients are able to access their information through patient portals. So it's opening up and it's improving communication. Is it perfect? It's not perfect, but we're continuing to get better every year, and those systems are improving to help open up communication. In addition, we utilize our systems to help improve and provide that quality of care which we're demanding, so that we're utilizing it to drive best practices, to drive the most appropriate care for the patient. And we're utilizing it to improve safety. The computers, just like the computers in airplanes, just like computers in the workplace, we're using them to improve safety, to prevent those errors that may happen. And so computers have become, and really it's not just the computer, but it's everything behind that. It's all the information systems are there to improve communication, to improve access to information, not only for us, but for our patients, but also to improve quality and to improve the safety that we provide.
It's great. I know it's a part of our lives, and so we need to continue to work to improve it. But
and we can rail against rage against the machine, or we can embrace that as just another tool to how we provide care.
I know that folks see our docs as certainly very special parts of their care, but there's also a person behind that stethoscope. So what do you do for fun?
I drive my kids around.
Dare I ask?
I know. I drive my kids around. Yeah. I collect salt on the road. Vermont and our community is such a great place, and so we really enjoy the mountains. We enjoy the skiing. My daughter enjoys the culture, and she's in theater.
Great.
So we enjoy that aspect of our community. So it's been great. I won't mention the beer. Am I allowed to mention the beer on TV?
Of course.
So it's all of it.
I can't stop you now. Well, Dr. Ferris, it's been a lot of fun talking with you about the Hospitalist program and your passion for taking great care of our patients, and it's showing. The program is evolving, the care is evolving, so thank you for being
Jill,
part of our team.
Thank you. I appreciate it.
Yeah. And I'm Jill Berry Bowen, CEO of Northwestern Medical Center. Thank you for joining us for this program.